Well, welcome everyone. On behalf of the Association of State and Territorial Health Officials, also known as ASTHO, I would like to thank you for participating in today's webinar on PHAB Domain 8 around maintaining a competent public health workforce. My name is Denise Pavletic, and I'm the Director of Public Health Systems Improvement here at ASTHO, and will be moderating today's session. This webinar is the second in a series of webinars around the topic of accreditation and quality improvement, and today's call is being recorded. Today's webinar is brought to you through funding and partnership between ASTHO and the Centers for Disease Control and Prevention, Office of State, Tribal, Local, and Territorial Support. The content of this webinar are those of the authors and do not necessarily represent the official position of or endorsement by the Centers for Disease Control and Prevention. So as you already know, the topic of workforce assessment and development is particularly relevant in today's new world of national accreditation. PHAB Domain 8 focuses on the need for health departments to maintain a trained and competent workforce to perform public health duties. Continuous training and development of health department staff is required to ensure continued competence in a field that is making constant advances in collective knowledge and improved practices. So our two case studies today will specifically address Standard 8.2, which is assessing staff competencies and addressing gaps by enabling organizational and individual training development opportunities. So our objectives today for today's webinar are to provide those two case study examples that demonstrate implementation of a workforce needs assessment as it relates to PHAB Domain 8, and implementation of a workforce development plan as it relates to PHAB 8. At the conclusion of the webinar, you will be directed to a link to answer a few questions on how well we have met these objectives. In the spirit of our own quality improvement here at ASTHO, we very much value your feedback, so please take a few moments to complete that evaluation. We're very excited today to bring to you the webinar. We have almost 100 people participating today, so we will look forward to a robust question and answer session at the end of the presentations. If I can take a moment to orient you to our ReadyTalk platform, there are two ways in which you can submit your questions. The first is through the chat function located on the lower left corner of your screen. You can submit questions at any time throughout the presentation using this function. Your second option is to hold your questions until the end of the presentations, at which time Kayla, our operator, will open up the lines for you to address the presenters. Now I am pleased to introduce our speakers today. Our first speaker, our first presentation comes from Florida. We have Kimberly Facer. She is the Workforce Development Grant Coordinator there. She's been in the Florida Department of Health Office of Performance and Quality Improvement since August of 2012, and she assists with the overview of the activities associated with the 2012-2017 Agency Workforce Development Plan. Prior to her current role, Kimberly interned at the Florida Department of Health Workforce Development and Performance Improvement sections in the summer of 2012. In December 2012, she acquired her master's degree of science, with her major being Performance Improvement and Human Resource Development. Second from Florida is Ms. Deborah Bragdon. She is the Workforce Development Manager at the Office of Performance and Quality Improvement with the Florida Department of Health. She currently manages a workforce development unit that provides training resources to help maintain a highly competent and qualified workforce. This includes leadership training, online journals, training resource library, instructional design and delivery, succession planning, 360 assessments, just to name a few. Deborah has been at the department for more than 15 years in human resource management, public health preparedness, and training and development. And Deborah has a Bachelor of Science degree and is a Certified Quality Improvement Associate from the American Society of Quality. And then our third presenter from Oklahoma is Miss Deborah Boyer. Deborah Boyer, affectionately known as Debbie, began her career in state service with the Oklahoma Department of Corrections in November of 1991. And she was promoted through the ranks and served in several positions there. In 1997, she was promoted to the Administrator of Human Resources, a position she held for nearly 9 years before moving on to a position in the Corrections Quality Assurance Administrator. In 2009, she transferred to the Division of Female Offender Operations. And then in 2010, Ms. Boyer accepted her current position as Director of Human Resources for the Oklahoma State Department of Health. Debbie graduated summa cum laude from Southern Nazarene University with a Bachelor of Science in Human Resource Management, and she also holds a Senior Professional in Human Resources certification. So that being said, I am pleased, or without further dialogue, I'm pleased to turn this over to our Florida folks, Kimberly and Deborah. Go ahead, please.
Great. Thank you, Denise. We're really excited to be here with you to share our experience, what we've done in Florida with our workforce development plan and our needs assessment. But first, what we'd like to do is ask you about your efforts related to these two areas by answering two polling questions. This is just to get an idea of where you are with your needs assessment or your workforce needs assessment. So we want to use this polling feature asking you to select the statement that would best apply to your organization. Okay, did everyone have a chance to respond to that? Okay, it looks like we have a fair number of participants that have implemented a plan or either in the process, and then it looks like it's kind of all broken down pretty evenly, and about a third that have not begun that. So that's just a really good pulse check for us and also for ASTHO. The next question is we want to find out where you are related to your workforce development plan. Okay, and it looks like from the results a fair number of folks have not implemented their plan at a little over half, and just a small amount that have either implemented or are in the process of that. So that's a really good feel for where everybody is in these processes. Okay, next what I'd like to share with you is just describing how our organizational structure is laid out here at the Florida Department of Health. We operate in a centralized structure, and we have about 17,000 employees statewide. Approximately 1,700 of those are central office program staff here in Tallahassee. We have 67 county health departments around the state with at least one location in each county. We use the acronym CHD to refer to the county health departments. Our health departments, they reflect the diversity of our state. We have each of the county health departments categorized based on the number of employees that work there, the county population, and also their operating budget. So we have, out of the 67 counties, 32 small counties. We have 13 medium counties and 17 large counties, of which Leon County, which Tallahassee is located in, is a large county. And then finally, we have 5 metro counties. Those are some of the larger cities in Florida, which many of you will recognize as being Orlando, West Palm Beach, Miami, Fort Lauderdale, and St. Petersburg. We also have 22 children's medical services offices around the state, and this is a collection of special programs for eligible children that have special health care needs in receiving services. Here in Central Office in Tallahassee, we have 16 divisions, and those offices and divisions set policy and guidelines for the county health departments as well as the children's medical services clinics to perform their direct services. We also have a medical quality assurance investigative office, and we have multiple offices around the state who investigate complaints against healthcare practitioners and facilities or establishments that we regulate here with the Florida Department of Health. We also have a disability determination office who is responsible for making determination of medical eligibility for Florida citizens who apply for disability benefits under the Federal Social Security Administration disabilities or the state medically needy program. And finally, in our labs, they provide diagnostic screening and other services to the county health departments, as well as official agencies, physicians, hospitals, and private labs. Next, I'd like to share with you a little bit of the overview of the Office of Performance and Quality Improvement, in which Kimberly and I work in. There are 3 sections within our office. The first one is workforce development. That's the section that she and I are part of. And what we do is coordinate and provide training opportunities and resources for our Department of Health employees. We are also in the preparing for the transition to our existing learning management system, and we will be beginning to use Train this July. We are really excited about becoming a Train affiliate and having access to some of those national trainings in the system, as well as some of the other features that we'll be able to take advantage of. In the performance improvement section, they coordinate the core departmental performance and quality improvement initiatives. This includes administering a county health department performance improvement process. This is done annually, and it's a series of standards and measures that all of the county health departments must respond to based on their various measures to reflect their county. And they are also, in performance improvement, responsible for all of the efforts related to the public health accreditation at both the state and local health department level. And then in the section of public health nursing, they provide leadership and support related to public health nursing practices and workforce development. And they also assist with recruitment and retention of nurses. Before we go into talking about our workforce development plan and needs assessment, I wanted to share with you some of our pursuits related to accreditation. In 2009 and 2010, we participated in the PHAB beta test. This helped the department kind of do a reassessment against what the proposed national standards were. And this also helped identify what our strengths and weaknesses were. Since 2009, we've been able to determine some of the prerequisites, which is having a local or state health assessment, a local or state health improvement plan, and also having a local or state strategic plan. Next, a systematic review of completeness was conducted. that is looking at existing local health department prerequisites against the PHAB standards. What we discovered was that we didn't have a state health assessment, a state health improvement plan, or a state or an agency strategic plan that met the PHAB requirements. So those had to be developed. PHAB recommends health departments conduct a self-assessment of the standards and measures, which we've completed, and now we're focusing on the availability of the evidence. So we did a self-assessment in September of 2012 for the state health office, and then in January of this year for the local health departments. Next, we pulled together a work group to discuss the self-assessment evidence gaps and identified potential strategies to address those gaps. Some of the results from our self-assessment you'll see in this graphic on your screen. And just take a close look at Domain 8 on there. You'll see what the results were, particularly to that domain. That all of the PHAB standards were reviewed and measured, and we determined if evidence existed, did it partially exist, was there none at all, or was it unknown? So taking a closer look at the initial assessment results for Domain 8, maintain a competent public health workforce, this initial assessment was kind of a recognition check. So you'll see here the findings that are located in blue. This is what the State Health Office identified as evidence that would be applicable to all of the 67 county health departments. What you see in white was specific to the county, and that evidence was then broken down with the county responses. So in this example, it shows that 5 of the county health departments didn't think what they had would be accepted by PHAB. So we addressed some of these gaps as a result of our beta test participation. We've tested the PHAB process, but it was also an opportunity for us to see where we stood against the national standards. So some of the things that we're pursuing now is that we're going to complete all of the prerequisites by the end of June, and then develop an action plan in how to address those system gaps. Once we gather the evidence to determine that, we're going to ask, does this evidence really meet the requirement? And also, we'll create an awareness of the standards and measures with our department staff. Based on the size of our agency with over 17,000 employees, it's something that we have to consider as far as the different levels and knowledge and understanding of what staff need to know about the standards and measures. So those strategies will be taken in consideration as far as how much information different levels of staff need to know about this. So that's wrapping up my section of this, and I'd like to turn it over now to Kimberly to talk to you about our agency workforce development plan and also our needs assessment.
Yes, thank you, Deborah, and hello, everybody. Thank you for joining us. Please recall that PHAB Standard 8.2 assesses staff competencies and addresses gaps by enabling organizational as well as individual training and development opportunities. In 2011, the Florida Department of Health developed and implemented a workforce development needs assessment that was among the resources utilized in the development of the agency workforce development plan. This plan is a statewide approach that builds on existing strengths of the department's workforce and addresses identified gaps to support both a qualified and competent workforce. And so this plan was funded by a CDC grant. It is a 5-year award that was designed to support changes in areas that improve or enhance the quality, the effectiveness, and the efficiency of our public health infrastructure to support the delivery of public health services and programs. And among those key areas that this grant supports is workforce and systems development. And so the analysis, design, and development of the 2012 to 2017 Agency Workforce Development Plan took place from May of 2011 to April of 2012 with assistance and collaboration with a number of entities. Quad R is a consulting firm that assisted with the research and collection of data. They also assisted with the development of a gap analysis and the creation of the comprehensive plan. We also had representatives across the department, both in county health departments and in central office, that provided input and feedback about the plan. We also had assistance from Florida Public Health Training Centers in the assessment phase of the plan. These training centers include the University of Puerto Rico, Florida International University, and the University of South Florida. And so the general process to create the plan is as follows, and we'll go into these in greater detail in the preceding slides. But as an overview, we acquired and reviewed data from internal and external sources, which includes the 2011 Needs Assessment Survey, as well as conducted a gap analysis from the obtained data. And then the next two sections were almost done concurrently, where the comprehensive plan and the associated implementation plan were created and developed. And so the acquired data derived from both external and internal resources, and this helped to determine current and prospective trends in public health nationally and within Florida. Existing materials and internal resources included an overview of the agency, as well as the needs assessment survey and leadership phone interviews and an online survey. And we will go into these further, starting with the needs assessment survey. And the Workforce Development Needs Assessment Survey was created with assistance by the University of South Florida and the University of Puerto Rico, Florida International University Public Health Training Centers. And the results from this survey were to be used to guide workforce development efforts of the department, as well as the development and delivery of training and education programs at the public health training centers. The survey was distributed to all employees via email, of which they had a time frame from May 3rd to the 20th to complete the survey. Respondents could complete the survey in one setting, and the response rates are as indicated in the slides. We had about 32.3% of the department employees access the survey, with about 20% completing the entire survey. And so the needs assessment survey itself consisted of 86 questions within 6 sections, as listed here. And we will go through these in the preceding slides. And so with regards to experience in public health, general items included relative length of employment within department, their position in place of employment, their perceived rating of knowledge in public health, and whether or not they would be considered being mentored or being a mentor, or mentee, I beg your pardon. And so continuing with this, we also looked at their awareness of products and services provided by workforce development, as well as their participation in training and development opportunities. And indicated below is a sample question and response items. With part 2, we looked at the perception of confidence for public health professionals. These were based on the Council on Linkage's core competencies for public health professionals. We looked at 4 competencies per domain for all 8 domains. As the competencies from the Council on Linkages is quite extensive, the 4 competencies per domain that were of apparent regard to the department were utilized. And so here we have another example of a competency, in this case in communications, with the general level of awareness and statements below. We also looked at the public health preparedness and response competencies and the perception that the respondents had with regards to those particular competencies. And this consisted of about 3 to 6 survey items per competency, as we see an example here. Okay. Capacity, technology, and business development. This entailed just a general overview of technologies available both at work and at home, as well as perceived computer skills, and the time that they would have for training and development, as well as their learning preference, whether it's online, self-paced, face-to-face, or blended learning. And so as you see here, here's another example. And of course, with demographic information, usual items such as gender, age, level of education, and place of birth. With the last section, we asked for public health matters perceived by the respondents, of which they thought were of concern within Florida. So this include HIV, teen pregnancy, suicide, among others. And so another resource that we used was from the leadership phone interviews. And this took place around the same time, or at least within the same year in June of 2011, where Quad R assisted with providing interviews with 18 Bureau and Division leaders, as well as County Health Department administrators, regarding challenges and opportunities for the workforce within Florida regarding recruitment, retention, and training topics. And we did receive a great response rate, and they were quite informative and had great dialogue and discussion with those questions. These questions were also similarly applied to the Leadership Online survey, where we had mid-level managers and supervisors answer, of which we had about a 55% response rate. And so looking at the external and internal resources, we conducted a gap analysis. The needs assessment data from the training centers were acquired, as well as the responses from the phone interviews and online survey. This helped to formulate the beginnings of the plan. From this, the workforce development staff looked at the plan provided by Quad and provided recommendations from the gap analysis. And then they took that draft and shared it with central office and county health department representatives for their review. And then upon further revision, it was routed for approval by our state surgeon general. And so the plan itself consists of 6 goals, 18 strategies, and over 380 activities. And as a resource, which can be provided later, it consists of the components of a workforce development plan, the basic structure that we had for this plan, which included, looking at the overview of Florida and nationally regarding public health, as well as the resources or the data acquired for the from the assessment results, as well as the plan itself. And then concurrently, we developed the implementation plan, which provides specifications to the goals and strategies. This would include the objectives, as well as the anticipated start and end dates for those activities, as well as the expected outcomes and the performance measures to determine the strength of those outcomes. We also have another template for your review, if you'd like, regarding the implementation plan. And so our next steps in the department, we are currently under review of the workforce development plan, and it will be revised as appropriated. Among the initiatives that we are undertaking is to align the plan with DOH priorities identified in those plans, such as the State Health Improvement Plan, the Assessment Report, and the Strategic Plan. Year 1 activities are being assessed on completion and outcomes, and Year 2 activities are being identified in the plan and under review for planning purposes. And so the lessons learned or recommendations we would like to share with you include the following, and we'll start with the needs assessment. For the needs assessment, it's very critical to establish criteria that would determine if a gap exists between desired and current outputs. And so consider if the data you will have or have acquired is quantifiable. How can you limit subjectivity and acquire objective data findings? For example, this can include performance outcomes, performance measures, as well as performance standards. Is this standards driven? Establishing criteria based upon use standards that your organization incorporates could support the validity of the assessment. And then regarding resource-oriented, this means consideration to the scope of resources necessary to acquire appropriate data for your assessment. So in this case, whether it's existing resources, internal and external resources, etc. With more sources and sources that would be appropriate to your needs, you could potentially triangulate your data to support separate yet common findings. And of course, we also mentioned to establish and apply a marketing and communication strategy. How can you raise awareness of your assessment? This would also, of course, help with the response rate as well. How can you encourage collaboration and buy-in? So effective communication across your organization to know what this is for and how the data will be utilized would be quite helpful. And so with the agency workforce development plan, consider the following questions. Does the plan align with your organization priorities? Does it align with your strategic plans, etc.? Are the current goals and activities attuned to the development of the workforce? And so as you create goals, strategies, activities, etc., it'd be very good to validate those and ensure that they reflect the concept of developing your workforce. And then, of course, are systems in place to fulfill the identified workforce development needs? It's very important to ensure that systems are in place to meet those needs. Certainly, in our case, Human Resources is separate from the Office of Performance and Quality Improvement. Much of the plan components entail a lot of human resource functions, and so it would be quite good to have that open discussion and have a good view of what things are in place to be able to support those needs. And that concludes our portion of the case study. Again, thank you for your participation. And Debbie, would you like to continue?
Sure, thank you very much. I appreciate the opportunity to be with you today and to share Oklahoma's experience from the human resources perspective. Like Florida, I'd like to begin by giving you just a brief overview of the Oklahoma State Department of Health and the Office of Human Resources. Our Oklahoma State Department of Health has a workforce of 2,100 employees statewide, and we're ultimately responsible for protecting and improving the health status of Oklahoma's citizens. Our health department is a little unique in that we have a mixed structure. We have a strong state health department system with 68 county health departments that serve 77 counties across the state of Oklahoma. And then we also have 2 independent city-county health departments that serve our large metropolitan areas of Oklahoma City and Tulsa. Medicaid, mental health, and environmental quality are administered by separate state agencies. And we do have numerous partners that include 66 Turning Point community-based coalitions that identify local community health improvement concerns and implement local solutions in collaboration with the health department, as well as our 38 federally recognized Native American tribes. The Oklahoma State Department of Health is a merit system employer. We have nearly 1,500 merit system employees, and we have over 450 at-will or unclassified employees, supplemented with a temporary workforce of approximately 140 temporary employees and student assistants. Our Human Resources Office has 27 positions, and of those, 21 are filled. And we're responsible for the typical functions that you would see in a Human Resource Office, such as benefits administration, employee assistance, classification, compensation, those kinds of functions. But we're also responsible for perhaps some unique functions in that we coordinate the process of our administrative procedures for the entire agency. We also include functions such as grievance management, occupational health and wellness, and also risk management. Like Florida, the Oklahoma State Department of Health participated in the PHAB beta test in June of 2010. Overall, Human Resources received the lowest score among all of the domains, 68.75%. So we had some challenges that we had to face. We had numerous areas that were identified as needing improvement. Our procedures were outdated or didn't exist. We had a system, no system for routine review of administrative procedures. We had gaps in our succession planning. Our performance appraisals were being provided. However, individual development plans on those performance appraisals were weak. We had a need to better document our trainings that were being offered and the linkage to performance. Our training record-keeping systems were fragmented, and there was a lack of evidence of consultation and technical assistance being provided to our local county health departments regarding workforce development. I came on board with the Oklahoma State Department of Health in December of 2010, and as we began to put systems in place to address the issues that we'd identified during our beta test, the standards were subsequently modified by the accreditation board. Once we had those new standards in place and they were issued, the agency then began to prepare for accreditation by establishing a core accreditation team. Human Resources was a member, served as a member of that accreditation team, and we did have responsibility for documenting domains 8 and 11. So beginning with Standard 8.1, Measure 8.1.1, basically this standard required documentation of an example of a partnership or a collaboration with educational organizations that promote public health as a career or to provide training in public health fields. So I'm sure like many of you out there, we have a student internship program which requires written agreements and provides interns with hands-on experience in public health. And so we documented this standard by using a copy of our completed and signed student internship program participation agreement. Also during the site visit, we had the opportunity, our partnering organizations had the opportunity to talk with site visitors. One of those partnership organizations was the University of Oklahoma College of Public Health, and they had the opportunity to discuss a contract that we have in place with the university to develop an education and training program to recruit, educate, and train racial and ethnic minority students to ensure that our public health workforce represents the diversity of the population we serve in the citizenry of Oklahoma. So through that contract with the College of Public Health, we do provide full tuition for bachelor's prepared students, and we include employment for those students with the Oklahoma State Department of Health. So bachelor's prepared students are working toward their master's in public health. Through the contract, we pay their tuition. We hire them as at-will unclassified employees working at least 20 hours per week so that they can get benefits as part of their employment. And then that contract does require a payback period with us for 1 year of employment for every 14 hours of tuition that's provided through the contract. So having the College of Public Health as a member of our partnership organization group that met with the site visitors really provided the opportunity for them to talk about this kind of unique recruitment and retention effort that we have in place. In terms of Standard 8.2, Measure 8.2.1, this standard does require documentation of a workforce development plan that includes nationally adopted core competencies, curricula, and training schedules, as well as documentation of implementation of that plan. One of the ways that the Oklahoma State Department of Health documented this standard was by providing a copy of our agency-wide competency-based training needs assessment that we administered in August of 2011. Now, we designed our assessment ourselves, so it's not a scientific survey, and it has not been validated. It's something that we put together in-house. We designed it around leadership effectiveness framework competencies. Those competencies have been adopted by the United States Office of Personnel Management, and they were also adopted by our Oklahoma Office of Human Capital Management. So we started with something that we knew had been adopted nationally, but also had been adopted within our state that we could use as the framework for beginning our needs assessment process. If you look at the slide that's before you, the leadership effectiveness frameworks, you have basic competencies that provide the foundation and are applicable for all employees. And then the supervisory, managerial, and executive level competencies are progressive, each building on the previous set. So, for example, managerial competencies would include the basic competencies, supervisory competencies, and then the managerial competencies. And so on our needs assessment for each competency area, basic, supervisory, managerial, and executive, we ask our employees in an online survey to rank order the importance of each of those competencies to his or her job, and then to tell us his or her level of need for the training in that competency area. Our assessment also asks participants to identify any additional competencies for which he or she would like to receive training that they felt would enhance their job knowledge, skills, or abilities. And our training assessment also asks some basic questions regarding the preferred training delivery method and the factors that influence participation in training. Additionally, supervisors were asked to think about the staff that they supervise, and for each competency area, identify the staff's level of need for the training. So this provided us the opportunity to take a look at needs for our employees, our supervisors, our managers, and executives from their own perspective as well as from their supervisor's perspective. We had over 1,200 responses to our survey, and the assessment results indicated that leadership, oral communication, problem solving, and interpersonal skills were the 4 competencies across all levels of our employees that were rated as being important to the job, and also where the respondents felt like they were the least proficient. So we took that data from the assessment that was done in August of 2011, and we immediately began developing and presenting courses that address those competencies. And then we used training agendas and curriculum and training rosters to document that needs assessment, delivering courses to address the gaps as part of our documentation process. We also documented compliance with the standard by providing a 5-year workforce development plan that links the delivery of training to the needs assessment for employees, supervisors, managers, and executives, and does require that all of our training curricula reference competencies that are directly addressed by the training that's being delivered. Our workforce development plan established 5 basic goals: that we would develop the plan for all groups of employees, and that it would include routine administration of our needs assessment and expansion of the assessment to include the public health core competencies. Our second goal was that the plan would expand the quantity and quality of our offerings available to our employees based on the training needs assessment. The third goal was that we would deliver training to geographically separated workforce using existing technology. And the fourth goal is that we would integrate our training information systems into one functional tracking and reporting system. And then finally, that we would implement a comprehensive program to provide tuition assistance and reimbursement of student loans to current and prospective employees. Our plan also included specific action steps. The visual that you see on your slide here, we did not provide as documentation, however, because we were still working to refine it. However, we do believe that it graphically illustrates the components that we have in place as well as the components that we're still working to implement. So it's a work in progress for us. During the site visit, we were given the opportunity to provide additional information. We discussed our workforce development program that begins with our onboarding process for new employees. That's a year-long process where the employee meets routinely with the supervisor and is also assigned a mentor. Our 2-day new employee orientation, where we have members of our senior leadership, our commissioner, and our deputy commissioners who present to every new employee orientation and talk about the vision, mission, and values of the agency. We also have included the College of Public Health in our new employee orientation to talk about the ethical practices and essential services of public health. The second day of our new employee orientation, we go over incident command structure in our situation room. We have mandatory annual training completion requirements, and those requirements are incorporated into our performance evaluations. So every employee has on their performance evaluation that they will complete our mandatory training requirements. We have quarterly leadership training that we offer in terms of bringing in college-level speakers to offer quarterly leadership training. And then we also have our own Oklahoma Public Health Leadership Institute, which requires participants that are from across the agency to form teams and work on projects. The projects link to our Oklahoma Health Improvement Plan. They work on the projects across 3 modules, and then at the end they present their projects to our executive leadership team, which would be the commissioner and his deputy commissioner's direct reports. Completion of the training, as I said, is reinforced through accountabilities on the performance evaluation. It's also reinforced through individual development plans on the evaluations. That becomes important because one of the things I think the site visitors wanted to look at, having had the opportunity to participate in a site visit at our county health department, is what the development plan looks like at the central office versus what it looks like at the county health department. When I had the opportunity to participate at a county health department, one of the things that we were asked to provide was some copies of performance evaluations of employees so that you could see the flow down requirement on mandatory training requirements as well as individual development plans that address any competency or training gaps for that particular employee. The site visitors also asked us about succession planning, and although we didn't have a formal succession plan in place, we were able to talk about our plans to develop career pathway descriptions, which once developed will include knowledge, skills, abilities, and competencies, as well as education and experience, but they'll also include the types of positions within the Oklahoma State Department of Health that someone who aspires to be in a higher leadership level position could work to gain that experience through various positions in our agency. So for example, if I come into the Oklahoma State Department of Health as a new employee and I aspire to become the Chief Operating Officer, we will have career pathway descriptions that will point out what types of experiences in what areas of the agency I could get that would best prepare me for that position. Our site visitors also wanted to know about our planned next steps for our needs assessment, and we were able to tell them that we plan to expand our needs assessment when we re-administer it to include the core public health competencies. We are expanding our survey in collaboration with a training advisory council that we've established here at the health department that has representation from all of our various divisions across the agency. Additionally, we're developing job descriptions for our at-will, non-merit system positions, and as part of that process, we've identified competencies for nearly 300 jobs that will be incorporated into our hiring and selection processes for these positions. And as our final piece of documentation, as I said earlier, we provided training announcements, copies of curricula, training participant rosters to demonstrate the delivery of courses linked to our needs assessment. I think it's really important at this particular, the most important point on this particular slide is to be ready to demonstrate to the site visitors how the workforce development plan is being operationalized. With regard to Standard 8.2, Measure 8.2.2, this requires documentation of training and development activities for management and leadership staff in the past 2 years and participation in courses. We will be able to document our executive development activities through our staff's participation in the Governor's Executive Development Program for state officials. This is a state-level program, a training program that's designed for cabinet secretaries, agency heads, and senior-level executives, and it is linked to and does address 5 of the executive-level competencies from the Leadership Effectiveness Framework. We also utilized a copy of our Learning and Education Assistance Program procedure, which sets forth the requirements for providing tuition assistance to our employees and includes an example of a reimbursement agreement. And we used documentation for our participation in the Kansas, Missouri, and Oklahoma Regional Leadership Institute, as well as our own Oklahoma Leadership Institute that I spoke of earlier. Standard 8.2, Measure 8.2.3. This standard requires documentation of consultation and technical assistance provided to tribal or local health departments. We were able to demonstrate this standard by providing agendas from a joint training conference that we had offered in partnership with 7 Native American tribes, and then also through agendas and training rosters for a communicable disease nurse video conference that we offered to county health departments statewide. In terms of lessons learned, these would be our recommendations. Don't be afraid to share additional information if the opportunity presents itself to do so during the site visit. I felt like we were able to share lots of really good information with the site visitors, and there seems to be some hesitancy to do that, but if the opportunity presents itself, share the good things that you're doing. Connect the dots as much as possible in terms of having a workforce development plan that includes a needs assessment, gap identification, and delivery of courses to address gaps at all levels of the organization so that it clearly demonstrates how you're effectively preparing your new employees and your current employees for a future in public health. And then also take the opportunity to discuss how you're going to continuously improve that assessment process and address gaps on an ongoing basis. Link as many other components going forward as you can, identification of competencies on job descriptions and job announcements, interview for competencies during your selection and hiring processes, performance evaluations in terms of accountabilities and individual development plans, and succession planning and career path identification. Ensure your human resources, policies, and procedures are kept current. They provide the basis for your HR activities, and as long as you build the PHAB requirements into those policies and procedures as much as you can, then you'll be consistently following your policies and procedures, and the requirements will be part of the way in which you conduct business. So documentation shouldn't be that difficult. Ensure your documentation clearly documents the standard. So the good news, I told you in the beginning, we had lots of challenges. We had a poor rating on the beta test. The good news is we received ratings of fully demonstrated for all HR standards in Domain 8 and Domain 11, with the exception of one measure, which we received largely demonstrated because the documentation for applicants meeting minimum qualifications was confusing on our documentation. We cleared it up during the site visit, but we did receive largely demonstrated on that particular measure. So it's good news. It was a challenging and rewarding experience, but overall, I think accreditation just encourages us to do what we do every day better. And so it's been a great experience, and I thank you for allowing me the time today to share our experience.
Great. Thank you to our presenters. That was very informative, and we have several questions coming through our chat function. And then, Kayla, if you could open up the lines and take any questions from our participants, that would be great.
Certainly. Ladies and gentlemen, over the phone line, if you would like to register for a question, please press the 1 followed by the 4 on your telephone.
So while we're waiting for Kayla to come back, I did get a lot of requests for the slides, and you will be receiving a follow-up email from today's webinar with the slide deck as well as a link to the recorded webinar. So our first question through the chat function is directed to Oklahoma, and the question is around whether you have worked with your employee unions on the education and career ladder pieces of the workforce development plans.
No, our employees, state employees in the state of Oklahoma are not unionized.
Okay. And this next question is for the Florida Department of Health. The question is, the 20% completion rate for the employee needs assessment, was it representative of your workforce? And if not, what did you do to ensure the planning would meet all staff needs? So that's for Deborah or Kimberly.
Yes, hello, this is Kimberly speaking, and a good question, yes. The characteristics of the respondents, at least with regards to education level, gender, and ethnicity, they were similar to that of the representation of the department. However, yes, with regard to the 20% response in completing the survey, that is most certainly a figure that would be looked upon in our next needs assessment for improvement. But certainly with what was provided, it was determined that it was similar, at least with regards to gender, ethnicity, and education level. And this also comes into mind too for improvement, the communication plan or the marketing of this plan, being able to ensure that it's known, of course, in advance, but as well as, to what extent, what will this be used for, what it entails, and how will it help the end users ultimately, because this is to be attuned to their needs, at least with regards to training and development opportunities. So certainly that is one thing we are considering in the next go-around for the needs assessment. Thank you.
Kayla, do we have any questions coming through to you?
Yes, we do have a question. It comes from the line of Lorianne DiMartini. Please go ahead.
Thank you. Well, it was a pleasure to hear this presentation. I'm only disappointed that I joined the conference halfway through. So my question is principally aimed at Oklahoma, and congratulations, by the way. Would you be willing to share publicly your workforce development plan, particularly those tools that you found to be helpful in crafting that plan?
We would certainly be willing to do that. If I can just get an email address, I'd be happy to share our development plan as well as our in-house crafted training needs assessment.
That's terrific. How would I go about doing that? Do I go through the facilitator or?
The last slide, this is Denise with ASTHO, and the last slide has my email address, so feel free to send your questions directly to me, and then I will forward them out to the appropriate presenter.
Thank you so much.
Thank you. And ladies and gentlemen, as a reminder to register for an audio question, it's 1-4.
So we're getting close to being out of time. Kayla, can we take one more question from our audience?
And there are no further questions on the phone line at this time.
Okay. So I do have a few more questions through the chat function, and one of them is how do we obtain the additional materials, templates offered by Florida? And again, let me forward to the next slide. My contact information, I think it would be easiest just to contact me directly here at ASTHO, and then I will forward out those questions and requests to the appropriate presenter. Okay, well, it looks like we are out of time, so we do need to conclude the webinar. We once again want to thank our presenters, our funders, and of course you, our participants, for the robust discussion and the terrific questions. If you are in need of further information about Domain 8 or other topics related to accreditation and quality improvement, you can contact me at the email address listed on the final slide. Once again, we value your feedback, so please take a few moments to provide us with your feedback on today's webinar. Thank you, and that concludes today's session. Everyone have a wonderful day.